Coming up next, we got a scary story with regard to concussions in football.
It is scary.
That we want to get into.
Yep.
Yeah, that's going to come up next with Dr. Chad Stevens joining us here on WBAP.
Keep up to date everywhere. News Talk 820 WBAP.
In the WBAP newsroom.
I just want to ask you a question. Yes. In the period, in the time that you've been alive,
right?
You ever think you had a concussion?
I know I have.
So you know you've had a
play
concussion.
Football. I know I have one.
Oh, playing football?
Yep.
How about Gaines?
I hope not, but I don't know. I mean, he's playing tackle football now, and I hope he has.
But just falling as a kid somewhere?
Yeah, I mean, could you do anything to just kind of bump your head and get one? Dr. Chad Stevens joins us right now. He's the president of the Noble Pain Management and Sports Medicine Center. He's an expert on concussions. We wanted to get his reaction to this latest study about the risk for those as young as 8 to get concussions in tackle football. I'll be honest with you, Dr. Stevens, this is scary. As a father who has an 11-year-old playing tackle football, should I be concerned?
Yes, sir. Thanks for having me on your show this morning. I think that is a scary study in that there is some concern that maybe subconcussive hits are being recorded in this study in North Carolina, and that they're finding some changes on the CT scans, MRIs that they're doing, because we've always used concussions and, the things that go along with that, such as dizziness, headaches, memory loss, different things like that, concentration problems, to really help us assess whether a player has sustained a concussion. And what this study is saying is there may be even microcellular damage going on that's not presenting itself clinically.
Last year, before the start of the season, my then 10-year-old had a baseline scan done. The league did that. They scanned all the 10-year-olds and had a baseline created. Should we revisit that after this year? And is that something you would encourage parents to do?
Definitely. I think there needs to be some kind of baseline training, and that those come in the form of an impact study or something like that that's a written or computer test. There's also, we're starting to do at the schools I take care of, some vestibular testing before the season starts, where we actually take them through multiple eye movements and assess whether or not they have signs of underlying concussions that they've suffered in the past. And so I think screening is important because it gives you a baseline to work off of when there's even minute changes.
Anything physical can have repercussions. Marlee McCormick, our news anchor, just told me that she has 2 daughters that suffered concussions from cheerleading. And so anything physical, sports related, whether it's tennis or baseball or whatever it may be, there's that chance of getting a concussion, I would think.
Yes, sir. I've been in several radio shows and some TV shows last week talking about that very thing, because there's been some reported studies and a good story out of UT Austin on a girl, Caitlin Donkey there, who was one of their cheerleaders, who retired early because of the amount of head injuries that she suffered cheerleading. So I think any sport we're putting our kids in. My worst injuries were BMX bike racing. When I played 5 sports for my high school, all my injuries were racing bicycles. And so there's various ways that people get hurt. I think the best thing we can do is not try to scare people away from football and other contact sports, but rather educate them and prepare them. By educating them, I mean help people, even the stands and trainers and doctors, understand the signs and symptoms of a concussion and, anything, even subconcussive that we're concerned about. And then how can we protect our kids? I've been trying to get the message out locally in the Argyle area about how we can protect our kids. I have a 6th grader playing, a 12-year-old, like an 11-year-old. And I've protected those boys with inserts in their helmets to help mitigate the amount of force when they take a hit. That's one thing it can do. You can also use the monitoring system, such as what they used in the North Carolina study. There's a company that we use called Head Health Network that has a device we put in our helmets to try to detect.
What's the name of the company? Yeah, I didn't hear it. I'm sorry. The name of the company?
The company's called Head Health Network. And
okay.
It's just like the Rydell sensors that they used in the study in North Carolina. It's a way for us to get real-time data on a sideline when a hit has undertaken that could be consistent with a head injury.
Do you have kids, Doc?
I have 4 kids, 3 boys, and my 17-year-old is only playing baseball now due to back fractures he suffered in football. My 12-year-old's playing football, and my girl is my 14-year-old cheerleader.
Okay, so you don't limit them from football.
I don't. My oldest son's injury is something that is kind of a chronic back condition he suffered, probably either lifting and preparing for football or in the early part of his freshman season. And so he is not playing because of his choice. But my 12-year-old plays, and I don't have any concerns. I do protect them, like I said, with the insert and the helmet, watching them closely. I'm going to eventually get the sensors on them that I put on some of the high schools around the area as well.
Just real quickly, since I think I'm right, the brain rattles around inside the skull is what causes the concussion. So with that in mind, is there really anything you can ever do to stop a concussion?
It's an excellent question, because what we find is that a lot of the concussions can occur from a hard hit where there's like a whiplash injury, or where somebody falls back and hits their head. And to your point, there are a lot of hits that cause a twisting or kind of a whirling mechanism, and it's hard to detect those with even the sensors that are out on the market. So it will be hard to completely stop head injuries from causing concussions, but I do think we can play smarter, and we can try to protect our kids and be aware of symptoms that arise and remove them from games earlier than later, and things of that nature to keep the game going, because there's definitely a decline in Pop Warner signups across the country. And I think that tells us that we have a reason we need to take pause and make some changes.
Dr. Chad Stevens, the president of the Noble Pain Management Sports Medicine Center, thanks for the insight and the time here today.